welcome everybody to the Health Insurance Education Series. This is our third year doing this series. This year, we're going to focus on Medicaid waivers. This is our first presentation for March, so we're going to focus tonight on the medically fragile and technology dependent waiver. We're going to have another presentation in April and another presentation in May to cover some more information. Before we get into too much information, I want to make sure that everyone has their language accessibility set up correctly. So every participant must choose a language. So there's an audio interpretation button down either at the bottom of your screen, or if you click more, and you should choose the language that you want to listen in on, either English or Spanish. If you don't choose a language, you're going to remain in the original audio, which is English, and so you'll only be able to hear whoever's speaking in English. If you want to listen in Spanish, if you pick the Spanish button, you will hear the interpreter speaking. Okay, so our information is going to be presented in English. If you selected Spanish as your language, you're going to hear the information translated verbally. All of the slides today are going to be in English. There is a Spanish version of all the materials found on the DSCC website. That's where all of the materials for all of the webinars are actually at. So any of our past webinars from last year, the year before, are there. Any of the materials from tonight are also going to be found on the DSCC website. Some housekeeping things. Captioning is available for the presentation. You can click the Show Captions button down at the bottom to turn on captions if you'd like to see them. All attendees are muted. You have the Raise Hand button or the Q&A button. The chat has been turned off. So we'll use the Q&A button for any questions that you want to type in. And then the Raise Hand button we will use at the end of the presentation if your question is maybe more complicated and you want to unmute and ask a question, we will allow you to do that at that time. We are recording the presentation, and the recording is going to be posted on the DSCC website with all of those materials that I talked about. Because it's being recorded, we ask that you don't share personal information either in the Q&A when you're asking a question, or when you unmute and at the end and you're asking a question, not to share any personal information because it will be part of the recording and we want to keep your personal information secure. Okay, so my name is Brittany Provost. I am the Benefits Management and Data Analytics Manager at DSCC. My team is kind of tasked with helping all of the DSCC care coordination teams navigate insurance issues. So we wanted to bring this health insurance education series to all of you to give you the information directly on insurance. And so that's kind of why we're picking different topics and bringing them to you each year. So this year, like I said at the beginning, is focused on Medicaid waivers. Each year it's different topics based on what we receive back from the feedback each year. So at the end, you'll have an option to fill out a survey, and we really take that feedback into consideration and kind of planning all of those. At DSCC, our vision is that children and youth with special healthcare needs and their families will be at the center of a seamless support system that improves the quality of their lives. And we partner with Illinois families and communities to help children and youth with special healthcare needs connect to services and resources. And one of the ways that we do that is like this, giving you guys information directly about things that you might need, like health insurance, to navigate those complex health conditions. All right, one last time, just for anyone that might have joined us late, about the language accessibility. Really, this is important if you want to listen in Spanish. You need to choose Spanish as your language down at the bottom. There's an interpretation button down at the bottom of your screen. You may also need to hit the More button to have it come up, and you'll choose your language that way. If you don't choose the language, you'll just hear English. Otherwise, if you choose Spanish, you'll be only hearing the interpreter. You kind of hear, I think, the English speaker in the background, but you'll be hearing the Spanish translation. All right, I am going to hand it over to our presenters for tonight. Liz Bailey and Zach Gibson to talk about the medically fragile and technology dependent waiver.
Thank you, Brittany, for the introduction. Thank you, everyone, for joining us tonight. As Brittany mentioned, I'm Liz or Elizabeth Bailey, and I'm the manager of the home care enrollment team here at DSCC. I'm here with my colleague, Zach Gibson, who is our assistant manager for home care enrollment. And then we also have Gab Schmidt, who is our assistant director of enrollment and specialty care. The three of us are going to kind of work together tonight to get you all the information that you need. I admittedly have a little bit of a croaky throat today, so if I take little breaks for water or if I have to tap one of them in, that's why. So my apologies in advance. Um, but yeah, let's get started. Um, so, um, the medically fragile technology dependent waiver program. I'm going to call it the home care program today just because that can be a bit of a mouthful. It's also frequently called the MFTD waiver program. And it's one of, I believe, 9 waivers in the state of Illinois. There's different waiver programs for different diagnoses or different needs. This one is specifically for children and young adults that are medically fragile and technology dependent. And we'll definitely get into the nitty-gritty of what that means and how children can qualify. But I just want to let you know that when I say home care program, this is what we are referring to. Okay, so this program would not exist without a little girl named Katie Beckett. And so whenever we present about the home care program, we always make sure to talk about Katie because this is her legacy, one of many, I'm sure. And I just want to make sure that we talk about her a little bit. So Katie was a little girl who was born in 1978, and she was born without complication and born healthy. Katie, when she was 5 months old, she was diagnosed with viral encephalitis and she was hospitalized and eventually required a ventilator 12 hours per day. And she needed that indefinitely. And so at the time, there wasn't anything in place for Katie to be able to return home with that ventilator support. Her parents did have insurance and eventually they exhausted the insurance. And so Medicaid was able to pay for the ventilator care for Katie in the hospital, but not at home. Katie's mom, I believe her name is Julie. She was a fierce advocate, I believe still is, for children with disabilities, and she advocated for Katie, and eventually she made her way to Congress and then also to President Ronald Reagan, and they heard her case. And I believe in 1981, they were able to pass a bill that allowed her to have the income requirements for Medicaid waived so that Katie would be able to go home and have nursing in the home and not be in the hospital indefinitely. It was then a federal mandate that there be a Katie Beckett waiver program in every state in the US. And so to this day, every state in the US does have a program like this. Of course, today I'm just speaking about the program in Illinois, but there is a similar program in every state, and they run differently depending on the state. There's no sort of uniformity state by state. So today we're just speaking about the one here in Illinois. Katie, again, was able to go home. She lived a full life. She even went to college, got a degree in English and creative writing. And when she passed away in 2012 at age 34, I believe, she was actually writing a novel. So her mom, was an advocate for her then, like I said, and continues to be to this day. So just wanted to make sure that I talked about Katie because she's the reason that this program exists and why families are able to get the support that they need at home. So again, we'll talk throughout this presentation about the different benefits that the program provides for children and young adults who qualify. But one of the benefits is care coordination to children who required skilled in-home nursing. And care coordination, we basically have a team of professionals who can provide support to families who really need help navigating their child's medical needs. So, helping with things such as being sort of a liaison between the nursing agency and the family, with a nurse being in the home, helping navigate equipment needs, medication needs, transportation needs, all kinds of things like that. And that's not an exhaustive list because I know that our care coordinators help with all kinds of things. So, we are operated on behalf of HFS. So we are the UIC Division of Specialized Care for Children, and we're contracted with HFS. So we're the operator of the program. So we submit all of our applications and renewals for the program to HFS, and we'll talk about that enrollment process as well later on. 1983 is the start of the program. As I mentioned, I believe Katie returned home in 1981, so DSCC began operating this waiver then. And then in 2014, we became the single point of entry for Illinois children in need of in-home skilled shift nursing. So prior to that, there were different ways that children could access in-home shift nursing, and then we became the single point of entry at that time. Okay. Home care eligibility. So general requirements are needed for a child to be able to be in our program. There does need to be an Illinois address. They need to be an Illinois resident. Basically, there needs to be a permanent home that a child could receive nursing in. Sometimes we receive referrals from families who are out of state. It happens pretty frequently, I would say. And we're only able to start that enrollment process when we know for sure that there's a moving date and there is an address in place. So if there's anybody on the Zoom call tonight who maybe lives out of state, just know that, we can talk about specifics offline, but we are able to start the home care enrollment process if you are out of state and 100% going to move to Illinois. There needs to be a trained caregiver in the home. And then ages 0 to 21 is the age group that we serve. However, for the waiver program, children and young adults can remain in the program beyond age 21 as long as they qualify medically, and they're already in the waiver program at the age of 21. So again, we'll talk about that later, but just know that for the waiver specifically, it can go beyond age 21, but the non-waiver program does end at age 21. Medical eligibility, that is very important. So the waiver program, there's a tool called the level of care tool that Zach is going to go into a little bit deeper later. But this level of care tool is looking at specific technology needs that a child has, as well as the care needs that they have. And each of those are given a certain amount of points. And then when we add those up, if they're at 50 points or more, then they would qualify for the waiver program. And that would mean that no matter the family's income, that income would be waived so that the child could get onto Medicaid to pay for all of the different services that we'll discuss later. So if they're over the 50-point mark, they definitely qualify, and that doesn't matter about your income or your insurance status. Non-waiver eligibility is a little bit more subjective. You do have to be a Medicaid recipient, so you do have to have Medicaid in place. You don't need to be at the 50-point mark on the level of care tool to qualify. But basically, we would gather medical records, do a comprehensive assessment, and submit everything to HFS for review for them to make a decision about that. That's not all we're going to say about that tonight, so just know that we'll talk more about that in specifics, but that's the non-waiver eligibility, sort of larger brush strokes. Okay. So home care eligibility. there must be a medical technology that the child is dependent on. And when I'm speaking about medical technology in the context of the home care program, we're talking about medical technology that's essentially keeping a child alive each day. So if they didn't have it, they wouldn't be able to survive. We, of course, know that there's all kinds of other technology that children have. We know there's assistive devices and things like that that help with communication and monitoring and things like that. But we are right now talking about technology that is needed to remain alive each day. And then they must need skilled nursing care. So the care needs that Zach is going to talk about with the level of care tool, we're talking about administering medication, measuring inputs, outputs, things like that, that are not so much the technology need, but the care need. Activities of daily living. We know, I mean, we talk to caregivers all day. We know these are so important in sort of getting a full picture of what it means to care for a child with medical needs. However, the activities of daily living in the context of the level of care tool are not scored. So it's something that we definitely write about when we write our letter to HFS, and we make sure that we do communicate a whole picture, but that is not a part of the eligibility. And something that we just wanted to highlight tonight is that even if there's no medical technology and a child does not qualify for the waiver or the non-waiver program, they do always have the option to apply for the home care program and submit an application. So that's something we're never going to say no to. We just make sure that you're making a decision with as much information as you can have, but you always do have the option to do that. I'm going to hand it over to Zach now.
Thank you, Liz. So as Liz said, my name is Zach Gibson. I'm the Assistant Manager for Home Care Enrollment with her. And what I'm going to do this evening is try to walk you through the specific medical technologies that help children be eligible and the care needs that might apply to them. So we're going to talk through each portion of this just so you can understand the specific medical needs that we're talking about. I think the most important thing to know is that we help families in pursuing the completion of this level of care tool, but it is all reviewed by the Illinois Department of Healthcare and Family Services when they're determining eligibility for both the Medicaid waiver program, the medically fragile technology dependent Medicaid waiver, and the non-waiver portion. So we can report all of the needs in this way, but it is still reviewed at HFS. So what I'm going to do, I'll first talk through both pages. You'll see this page and the next page, just so that you have an idea of what the specific care needs are. And then I'll provide just a little bit of information, general reminders about how the tool is used and ways that you can think about care needs if you're considering a referral or pursuing this program for yourself. So the first area that you'll see here on the level of care, that big heading says technology needs. As Liz mentioned earlier, there is a need for both technology and care needs. So all of the things that you see listed on this page would be considered technology needs. You'll see things like ventilator support, CPAP and BiPAP use or a non-invasive ventilation, and tracheostomy care. So those things are all related to kind of airway and respiratory support. One thing that you should know, you'll see little numbers next to each of those. We were talking about that threshold of 50 points for eligibility for the medically fragile technology dependent Medicaid waiver program. You'll see that some of those have very high scores, but if you have certain things in place, you wouldn't always get scores for both items. So just know that we will help you figure out the specifics of any eligibility if you're reaching out about programming. You will also see on here other respiratory supports like nasal stents and oxygen therapy. You'll notice that there's some specifics about how frequently those supports are used or how many hours throughout the day. One important thing to note about all of these technologies is that HFS does consider the use of technology on a daily basis. So there are definitely times when children might need oxygen support if they're having a respiratory illness or a respiratory virus or shortly after an admission for a short time to recover. Those acute periods of illness are not considered an ongoing need unless it's going to be kind of every day that they need that support for a certain amount of time. And again, those are all things we can assess as we look at this together with you. The other technology needs that you will see here are more related to feeding needs. So you'll see IV infusions for children who may need to receive their nutrition via a central line or an IV. You'll see NG tube feedings, meaning a feeding tube through the nose, or a G tube or J tube, which is a feeding tube through the side of the stomach. Those types of technologies typically are going to be used for primary nutrition. So there's sometimes when a child may be able to eat lots of things by mouth, but they still require some support with a G tube or an NG tube. And in those situations, if it's not considered a primary daily support for nutrition, HFS may question if that is a medical technology as scored on this assessment. The other thing you'll see there is peritoneal dialysis. So if that is occurring in the home, that can also be considered a medical technology. Now, just a reminder with each of these things, they are happening on a daily basis. And as Liz said, they would be used for daily life-sustaining supports. Something else I was going to say, and I forgot what it was, but that's okay. Those are all the primary technologies. We'll talk a little bit about other technology in just a moment. So aside from those technology needs, we do have a couple of pages here that you'll see. I know they're quite small, but a couple of pages of different care needs. So there may be other types of medical equipment that are used in the care of a child or someone who might qualify for the program that are not considered technology, even though those items plug in and they might require some special training to use. So things like suction, pulse oximetry, feeding pumps count, but they have a little different scoring here in this care needs section. Things like catheterization, seizure interventions that might have things like a vagus nerve stimulator. Those types of supports don't count as technology, but they count as care needs here. One important thing about these different care needs that you're seeing on the screen is that a child cannot score these points on the level of care tool if they are able to provide the care for themselves. So this is care that is needed to be provided by someone else. So either a trained caregiver or a nurse in the home. So going down the list, again, I mentioned suction, tracheostomy care often is that suction or kind of changing trach ties, trach changes at home that might occur. Vital sign instability, you'll see those words listed there, third down, I think. That can be a very subjective term, and so we would help in determining if that's an area where there might be care needs for a child. That would be related to things like oxygen saturations, heart rate, just monitoring those vital signs and requiring intervention to keep that child safe and healthy at home. Things like administering more oxygen. There's several other examples that I can't think of right now. Special treatments is an area that really encompasses a lot of other medical care. So things like the use of nebulizer treatments, the use of cough assist or other respiratory care like percussive vest therapy. Those types of supports are often completed multiple times throughout the day, and each of those occurrences would be counted as a separate treatment here on the level of care tool. You'll also see medications listed. So some children take many, many medications. They would be scored in the complex area there as long as there's 7 or more medications. But there are different levels depending on the medications. And those medications are going to be prescribed by a physician. So they might be both prescription medications and over-the-counter supplements or vitamins, minerals that are prescribed by the physician. Things that are not included there are things that might be elsewhere on the level of care, like nebulizer solutions that are counted as a treatment instead of a medication. You'll see that there's an area here for feeding schedules. You'll see some hours per day listed. So this is additional points related to the feeding care that is required for the feeding technology that you saw listed on the first page. So again, different for IV feedings or NG or G-tube feedings. On that third page, the little half page that you're seeing there on the right, talks a little bit more about other cares that might require intervention. So things like aspiration precautions related to tube feeding. So that would be children who do require our support in avoiding aspiration. So things like sitting upright, venting a G-tube, providing extra care related to their feeding. There's a category here that, again, is a little bit vague, but specialized input-output monitoring is really when we are focused on helping a child stay healthy with things like hydration. And so monitoring that and having to provide intervention. So if hydration is low, providing an IV or increased fluid, it's not just the need for hydration, but the fact that we're intervening is what allows it to be scored on this assessment. Again, intermittent catheterization, something that would occur daily, typically. And we would be looking for that in terms of, can the child do that for themselves or not? There is a section here about seizure precautions and seizure interventions. So when children do experience seizures, or I should say when young people experience seizures, they certainly can have protocols in place, things like requiring a helmet or requiring certain monitoring, anything that requires intervention rather than just observation of seizures. And then there is a section here for the frequency of seizures requiring intervention. There's sterile dressing changes, which again is a potential nursing need. This does not include the dressing changes related to a tracheostomy or a G-tube site. It is more for kind of active sterile dressing changes elsewhere on the body, not those areas. And then you'll see a section here that says hospitalizations and ER visits. So this is an area, obviously the home care program is in place to try to help children remain out of the hospital and out of the emergency room. But there are times when people are pursuing the program that they have had a lot of interactions at the hospital. So there may be points scored for those hospitalizations, things that have occurred in the previous year. So anywhere up to a year from when you're applying, and those would be for emergent care. So things like planned hospitalizations for certain surgical procedures or EEGs, sleep studies, those admissions might not count toward that score because it's not emergent care. But anything that is unexpected, or if an admission turns into something unexpected, that could certainly be scored there. Okay. Now, as I talk about all of these things, I mentioned earlier that these would be care needs and technologies that are used on a daily basis. And as Liz said, they are for life-sustaining supports. We know that sometimes there are periods of illness, I said this earlier, where there are increased care needs that occur. When we're working with you or with any family who's pursuing programming, we're going to help gather medical records to document all of the different care needs. So we work with parents and families and individuals who are reporting their care needs, and it's important for us to hear that from you. But we do have to have medical documentation of all of the needs here on the level of care. So that includes things like hospital reports, doctor visits, letters of medical necessity, and we would help seek all of that in putting this together to support the care needs that are being reported. Just a reminder, as Liz said, things not included here are activities of daily living, so bathing, dressing, toileting, diapering, those types of activities. I often get the question if therapy activities are included, and unfortunately, things like physical therapy, occupational therapy, and speech therapy in the home are not scored on the LOC at this time. So those are also not included. As you can see, there's little numbers next to everything. So that's where we get to that number of 50 points or above for the medically fragile technology dependent Medicaid waiver program. And then as we talk about the process for eligibility and the application process, it's important to know that the level of care tool is used as a snapshot. So it is a picture in time right now of what the care needs are today. And there are going to be times where there's periodic review of those care needs in order to determine if that child is still eligible or needing those services. And so that does happen on prescribed periods of every 6 months for the first couple of years, but it can also happen if there's significant changes to care needs. As an example, if a child previously had a feeding tube, but no oxygen, and now requires oxygen, that would be a potential increase in care needs. Same way if a child had a ventilator and no longer uses that ventilator, but still has a tracheostomy, we would adjust that scoring to reflect the new care needs at that renewal or review. Okay. All right. So we've been talking about the medically fragile technology dependent Medicaid waiver versus non-waiver. And so it's just important to know the differences between the populations who might pursue those supports. So as we said earlier, and as you'll see here, both waiver and non-waiver supports do require that there both be a medical technology and care needs, just of varying levels. For the waiver program, individuals do have to be under the age of 21 at the time of enrollment. However, if they've been enrolled prior to the age of 21 and maybe gone off the waiver, so they lived in Illinois, got enrolled on the Medicaid waiver program here with us, moved away, and then moved back to Illinois later, if they still have care needs that might qualify them for that, then they are able to potentially pursue that program after the age of 21 if they've been a previous participant. And it is important to note that this is a Medicaid waiver program, so people can apply regardless of parental income or household income, because this will waive the financial eligibility for Medicaid to allow us to help you pursue Medicaid to have the program if meeting the 50 points on the LOC for the medically fragile technology dependent Medicaid waiver program. Now, in the non-waiver program, the biggest differences are that you would have to have a need for in-home skilled shift nursing, but maybe less needs. So you're still going to have technology and care needs of different kinds, but maybe less so than the waiver program. You do have to be under the age of 21, and you do have to financially qualify for Medicaid. So you would have to have Medicaid actively in place in order for us to assist you with that application for a non-waiver application. It is important to note that the age of 21 is a cutoff. So if you're in the non-waiver program and you get to the age of 21, if the care needs are not meeting that waiver level of support, 50 points or more, then we will have to think about referring you to other programs that might more appropriately meet your needs as you continue to age past that age of 21 when the program cuts off. Okay, there's a helpful tool here that you can take a snapshot of. It just shows us a little bit about the specifics for both the waiver program and non-waiver. And then there's that darker blue area in the middle that helps us see what is common between the two portions of the program. So we'll start with the commonalities. They're both managed by HFS and funded through Medicaid. They are both operated by our home care program here at DSCC. They would still both have monthly contacts with a care coordinator as part of the program, and there would still be approved nursing agencies with each part of the program, and the annual renewal. As I was saying, there are recertifications of care needs, and that would happen in both waiver and non-waiver. I'm not going to read through each of these areas for you, but it is important to know right now the way the program works. There are some additional waiver services that you don't get in the non-waiver program. So things like access to additional respite hours. There are some additional waiver services that exist. We're going to talk about those a little bit later, I think. I can talk about them now if you prefer, Liz. Okay.
We can do it later. It's okay.
We'll do it later. The main thing with waiver is that you cannot receive other Medicaid waiver programs in order to receive this program. So there are other waivers. There's 9 total in the state of Illinois, including the medically fragile technology-dependent Medicaid waiver program. So those would be things like waivers for the Division of Developmental Disabilities, waivers through the Division of Rehabilitation Services. So if you have one of those, you might not be able to pursue our waiver, or you would have to choose one or the other. The other option is you could have non-waiver home care here with DSCC and have another waiver in place. That does happen at times. But a reminder that non-waiver program does cut off at age 21, unless you're in the waiver program. One other important thing that I'm not seeing noted here is just a note about immigration status. So we do help families from many walks of life and many immigration statuses that are requiring supports. But in order to pursue the waiver program, you do have to be a citizen of the US. Otherwise, we can help you pursue a non-waiver program as long as Medicaid is in place. Okay.
Thank you so much, Zach. And I just want to say, Zach mentioned this, but the level of care tool can be overwhelming. Zach did an amazing job at going through it. But if you were to call us, you would talk to Zach, me, or Gab, and we would go through that with you line by line and make sure that, we're scoring that specifically for your child. So I just wanted to point that out. So with regard to waiver services, I wanted to talk a little bit about what's available. One of these services listed here would have to be utilized, or there would have to be a need for one of those for us to be able to submit the application to HFS. We're not able to submit an application for the waiver just for the purpose of getting Medicaid. There needs to be a need on this list here. Definitely the one that is utilized the most, and the main reason why we do receive referrals is for skilled shift nursing. That phrase, the way that I explain it to families is it's basically a full-time nurse in your home. Typically, nurses prefer to work something like an 8 to 12-hour shift, multiple days per week. That is the goal of skilled shift nursing. So this would not be a nurse who's coming in to check your vitals, administering medication, and then leaving. This would be a longer shift. Care coordination is what I discussed previously. Care coordination can look a lot of different ways, but really the way that I explain it to families is it's to help you navigate your child's complex medical needs and be a support for you. Care coordination can be, a care coordinator attending an IEP meeting with you. It could be, again, helping sort of be a liaison between the nursing agency and the family. It's an adjustment to have a nurse in the home. And so sometimes, we can help mitigate any issues that arise there. Transportation is something we can help coordinate and just sort of be a support. Sometimes it's just being a listening ear, but there are some practical applications as well. Environmental modifications. So for the waiver program, each child that would be enrolled would be given $25,000 to use towards environmental modifications over the course of 5 years. So there's a list here, obviously, of the things that fall under that umbrella. We have electrical modifications. We do see this a lot for children that require a ventilator at home. That can use a lot of electricity. It does require stable electric panels at home. And so our program can help pay for the cost of a dedicated circuit in the home. So we do see that a lot for children that are coming home from being hospitalized. Maybe they were born and haven't been home yet since they were born and they require a ventilator. And so this would be something that would be modified to the home before they discharge. Accessibility modifications. The waiver can pay for a ramp, for example, to get into the home, like a wheelchair ramp. Another benefit that is available would be a modification to a bathroom to make it accessible. So there's definitely some more specific stipulations to that I won't go into tonight, but you can always call us and ask us about that. But essentially, converting a shower to a roll-in shower, things like that. Generator installation is something that's a relatively new benefit. We have actually seen quite a bit of families using this benefit, and that's really just to make sure that in the event of an emergency, if the power were to go out, that there would be backup electricity. Vehicle modification would be the cost of a lift or a ramp to get in and out of a vehicle, typically a van. And then extermination. It would be the cost of extermination for rodents or pests. Respite is a benefit of the waiver program. So on the last slide, I think it was detailed out that it's 336 hours of nursing or of respite care per year. So this can look a few different ways or a couple different ways. So a lot of families choose to use this respite on top of the nursing care that they're allocated through the waiver. So, maybe they were allocated, I'm just going to come up with a random number, maybe 35 hours of nursing per week, 40 hours a week, and then they have the extra 336 hours per year. So if they've used all of the nursing hours, they might use the respite hours in addition to that. They can be used, if a family needs to go away for the weekend and they can't bring their child with, respite can be provided by the nursing agency in the home to provide 24-hour care if the agency is able to do that. Or it can be provided in a facility that would have an available bed for respite. So there's different facilities around the state of Illinois that have that as an option. But I think we do find that more families use the respite benefit at home. Specialized medical supplies and equipment. This could be a wide range of things, but something like a scale-mobile to get up and down stairs with a wheelchair, things like that. And then training of nursing personnel and families. So if a child, for example, is discharging home for the first time and a nursing agency is coming on board to provide support in the home, the waiver could pay for a nurse to be trained in that child's care so that they wouldn't be doing this when the child's already home. So that's just an example. Okay, so I wanted to just take a few minutes tonight to talk about the enrollment process because I think it's important to know the timeline and what it looks like should you give us a call to see if your child might qualify. So at the end of the presentation, you'll see an email address and kind of ways to contact us. But really, no matter how you decide to contact us, all of the referrals do come to me, Zach, and Gab. And so it's not just going out into the abyss in the internet, it's coming to the three people you see here. And so referrals come to us from all different places. Definitely the majority of them come from hospitals. We do have liaisons who are in the hospitals, in a lot of the children's hospitals around the state. And they sort of, round with the medical teams there and provide referrals when appropriate. But we also get referrals from families calling off of the website or schools or doctor's offices. Whoever wants to call us would be available to do so. And what we'll do is we'll review the referral and we'll assign it to one of our enrollment specialists around the state. Our team is statewide, and so we have enrollment specialists all over. We definitely have more in the northern region just because we have more referrals up north, but we do have enrollment specialists around the state. So no matter where you live, you're able to apply and go through the process. We do try to have enrollment specialists calling families within 1 to 2 days of being assigned the referral. I think our team does a pretty good job of that. And really the goal is for them to introduce themselves and schedule a home visit. I'll talk about that a little bit in a second. One of the things that we do initially is really to have the paperwork signed that we need to be able to request medical records, speak with different providers. We do need an authorization for every provider that a child has that we would need to request records from. So we don't have like a blanket authorization or anything like that. We do get authorizations for each provider. And then we request records, as Zach mentioned, from the last year or from birth until present to be able to show HFS that everything that is being presented is backed up in the medical records. As I mentioned, we schedule a home visit. So for every application that we submit, we do come out and do a home and community assessment. That's really for us to obviously meet you and do our comprehensive assessment in person and learn more about your family and your child just to see how we can help. And then we're also looking at your home environment to see if there's any safety concerns, anything that needs adapting, as I mentioned in the last slide, if there's a need for a ramp or if there's any issues with the electric or things like that, we would just be able to actually get eyes on the home to see how we might be able to help. And then obviously just talking with the family about any concerns with the community and safety and things like that. The comprehensive assessment is really just us asking you questions about your child and your family so that we can find the different needs that you might have and so we can help. The questions are voluntary. It's just, the more we know, the more we can help. And then a Medicaid application. So as Zach mentioned, that for children who do not already have Medicaid in place and they qualify for the waiver, we would assist the family in applying for Medicaid with the waiver application. And then in order for us to submit the application to HFS, there would need to be a few things in place for them to accept it. The child would need to be medically stable. So for children that are in the hospital, this is typically when we're monitoring that very closely so that we know that they're definitely clinically, looking like what they'll look like when they go home. If a child was just transitioned, for example, to a home ventilator from the hospital ventilator, we would typically need at least a few weeks of stability to be able to submit that application. We would need a discharge date or timeline, like a loose timeline. And then caregiver training would need to be at least underway. So all those three things need to come together for us to submit the application. Okay, so once we submit the application to HFS, they review and provide a final decision. For waiver applicants, we do know that as long as they're over the 50-point mark and all of the records are there to substantiate that, then we would be getting that approval back with an amount of nursing that they would be approved for. For non-waiver applications, we would get a decision that would either be an approval or a denial. And then for waiver applications, we would, sorry, I'm just realizing that this would just be for anybody approved. We would be calling the family to inform them of the approval and discuss the next steps. We do try to call the same day. We don't want a family or caregiver hearing from somebody else. So we always try to call right away when we get that approval back. And then once we kind of work with the family to coordinate a transfer to the care coordination team, we would transfer the case out of enrollment to care coordination for them to work with the family and the child on a long-term basis. So the time with enrollment is pretty time limited. So we do transfer the case out eventually. Okay. I was looking at the time, so I was trying to kind of zip through the last couple of slides. So I'm sorry if that felt rushed. I could talk about this for a lot longer, but I want to be respectful of everybody's time. So applications and referrals, as Zach mentioned before, you can kind of screenshot this or write this down. You can always go to our website. There's all the information there for referrals. But this is just some of the information that would need to be provided for us to be able to follow up on the referral. Another way, so this is just a visual of the website, so you know where to go. And again, another way to make a referral. So how we help and refer a family.
All right, thank you, Liz and Zach. In the interest of time, I'm going to just wrap up my last few slides,
Yep.
and then we will get to whatever time we have left for questions. So we will still have a few minutes for questions after I kind of get through some of these things that will wrap us up. So we just want to thank everyone who tuned in today to participate in the training. We hope that you found it helpful and learned something new. Again, all of the materials, the recording is all going to be posted on the DSCC website, so you can listen to it later if you need to, go back and look at the slides. All of that will be there. When you close out of the Zoom, there's going to be a survey that pops up at the end. And if you have a couple of minutes to just fill that out, we would really appreciate it. Your thoughts are very helpful and important to us. Like I said, we kind of build off of the webinars based on your feedback. So whatever topics that you might want to see training on, we're going to use that to build next year's. So if there's other topics that you want training on, even if it's not health insurance related, please fill that in so we can take that into consideration. Future webinars that we have. So like I said, this is part of a waiver series for Illinois Medicaid waivers. So in April and May, we're going to focus on a couple more of the waivers that are available in Illinois. So if you have interest in learning more about those, please tune into those. You can register the same way that you did for this webinar, and all of that information is on the website in the same location. And then finally, the contact information, like Liz and Zach provided, the DSCC phone number is the best way to get in touch with everybody. So you can call and ask to speak with the home care enrollment team and ask specific questions of them. You can also submit a general email to the DSCC email if you have questions after the webinar tonight that we don't get to, because likely we won't get to every question. We'll try to take them down and get responses back to people. We do have the ability to download the Q&A, so we'll try to get information back out there if we can, but I know a lot of these situations are likely very individual, and you may want to talk a little bit more through about your situation and kind of what, might be most relevant for you and your child. So that's how you can connect with us. I'm going to stop sharing the slides, and then we will look, I think, at the Q&A to see what questions we have. And Liz and Zach, I defer to you on exactly what you want to go into with the time that we have.
Right.
If you guys don't mind, I did see one question in the Q&A, which is really good and very timely. The question was, with the potential cuts to Medicaid, what's the state of Illinois doing to keep or change these programs? I'm sure it's a loaded answer. You're absolutely right, Megan. It's a really unpredictable time right now. I think we all know that. So I don't really have a good answer for you other than to tell you that our administration is looking very, very carefully every day at the news, what things are happening, of course. But the good news is that this home care program has been around since the 1980s. We don't anticipate it we don't anticipate any cuts to this Medicaid waiver program. So we're very hopeful that nothing is going to be changed. So at this point, we've heard no changes, which is good. So I know that doesn't completely answer your question, but unfortunately, that's the best answer we have right at the moment. So.
Okay. I'm looking at Sarah Mitchell's question. You mentioned that we could still apply even if we don't meet the 50 points on the level of care tool. Has anyone ever been accepted into the program even if they don't have 50 points on other factors? I, Gab, you might be able to answer this, but I know that in the time that I've been here, I have not seen that. You do have the ability to apply and then you'll get the denial and there's a way to appeal. So that's what families typically do. They understand that they will get the denial and we communicate that very clearly. And then they'll have the opportunity to appeal that decision. So
Yep, absolutely.
Question. Would it be helpful already to have services in place for progressive diseases, Duchenne muscular dystrophy specifically, 15 and will progress soon? So we work with a lot of children that do have Duchenne, and I know that that is progressive, and I think it's really good that you're looking ahead and making plans. In order for the home care enrollment process to begin, there would need to be that medical technology in place now, for us to be able to submit the application. So you can certainly check in with us, however you want to, however often, and we can do an assessment of your child's specific situation. You can just give us a call, and we can talk about that.
Liz, I'm going to jump in on the question of, has there been any updates in regards to parents who are also CNAs being eligible to be their child's paid caregiver? I will tell you that our administration is working closely with HFS to hopefully get this initiative approved. Right now, there's no further update. It has not been officially approved yet, but we are very hopeful that that may be coming in the hopefully near future. But unfortunately, we don't have a date on when that may be approved yet.
Okay.
Going to go back to the question that Liz had answered regarding a referral for a child with Duchenne muscular dystrophy. Like Liz said, we can assess now. And as I was talking about the level of care, just remember that it's a snapshot of what's happening today. So if those care needs change in 30 days, then we can talk with you about that as many times as needed to see if there's eligibility being reached. We're often tracking those referrals with families on an ongoing basis just to try to help them understand what services might be available to them.
Yeah, that's actually a good point, Zach. Sometimes we work with families who maybe have a surgery scheduled for a month from now. And so we'll put a calendar reminder for us to contact the family after the surgery to see if the child qualifies at that point. So yeah, we can definitely talk with you individually and see what we can do. I think we answered.
I think we got almost everything.
There was a question regarding nursing allocations and nursing agency billing related to the allocation. I'll just say the answer that I believe is correct, and you two can correct me if I'm wrong. But the question is there a cap or the amount for overhead costs that a nursing agency can charge toward an allocation? What I will say is I don't believe there is a cap, but it is different for every agency. So the thing that we see is an allocation that is available for the participant as awarded by HFS. And then there are rates set for different levels of nursing. Now, those rates are not necessarily what the nurse is paid. That is the amount that the agency can bill for that type of nursing hour. So there is not a set rate on what that agency chooses to pay their employee, the nurse, out of the allocation or out of that nursing rate that HFS has set.
Precisely, yeah.
Mm-hmm.
All right. I think we will wrap up there. Thank you all so much for being here and for presenting and everyone for tuning in. Feel free to reach out to us if you guys have any further questions. Have a great night.
Thank you, everyone.